This is my clinical presentation on the SOAP strategy. So today I'll be presenting a case of uvular necrosis following endotracheal intubation. So this is a rare but self-limiting complication. It's often mistaken for infection or more serious pathologies. So the first thing we're going to discuss is the chief complaint. The chief complaint is persistent sore throat and a foreign body sensation after intubation. Moving on to the history of the present illness. So this is just going to give us an idea of what has been happening leading up to seeing the patient. Our patient is a 69-year-old male who developed a sore throat and a persistent foreign body sensation shortly after being extubated. He had undergone intubation for management of acute pulmonary edema due to severe aortic stenosis. The intubation was actually very smooth and completed on the first attempt. On review of systems, he denied fever, chills, hoarseness, or difficulty swallowing. There was no GI or respiratory complaints. He has a history of hypertension, severe aortic stenosis, and acute pulmonary edema. He is a retired non-smoker, uses no alcohol or drugs, and his family history is non-contributory. Oropharyngeal exam showed a blanched and necrotic distal half of the uvula, with some erythema around the area. There was no signs of infection, labs were unremarkable, and no imaging was needed. The diagnosis was clinical. Moving on to assessment. Our assessment was uvular necrosis, likely from compression injury during intubation. The uvula may have been trapped between the endotracheal tube and the hard palate, or what could also have occurred was the uvula was trapped between a suction catheter and the hard palate. Lastly, moving on to our plan. We advise supportive care with acetaminophen and lozenges. No antibiotics was needed. The patient was reassured and instructed to monitor for worsening symptoms. The necrotic tip sloughed off spontaneously and the symptoms resolved within a week. To conclude, this case highlights a rare but benign complication of airway management. Awareness helps avoid misdiagnosis and unnecessary treatments. Conservation management is usually sufficient, but full recovery is expected in problems like these. Lastly, this is the link where I found the case from DMG case reports. That will be all for today. Thank you for watching.